Hey everyone, Dr. Charlie Johnson, physical therapist and back pain specialist. In today's video, I want to talk about a common problem that I see consistently when working with people who have lower back issues. And that's that they wake up with a lot of stiffness and discomfort that causes them to struggle as they sit on up. And then when they go to stand, they have a lot of stiffness and trouble standing up straight, such that they're hunched over as they begin the day. So I want to talk about how I might help somebody with that. And before I get started, I help people get back to normal without pills, injections, or surgery. So for anybody out there who's looking for relief, call 484-552-3767. Now, how do we reduce back stiffness first thing in the morning? Well, I'm just going to give you, a couple specific movements that I generally recommend for folks, as well as just a couple different strategies to roll on over or kind of push yourself off and get out of bed, right? Because the two big issues are the kind of transition, the rolling first thing, and then the getting on up such that we can actually move. So here we go. Here's a little, 45-second, 30-second movement sequence that we can do. First things first, here we are. We're laying in bed, our eyeballs pop open, we woke up, and a lot of people just kind of get up like this. Well, we know that that increases pressure in the spine, especially first thing in the morning when we have a lot of pressure on the disc, because the discs have been, there's been no pressure on them throughout the night, and now they're plumped up, and when we go to sit on up, we stress them out. So instead of just doing that, slide the heels up, and then when they get here, do 10 of these each side. It might not even need to be 10. You might just have to do a couple. So I recommend folks do these first thing, and then they go right into just a 10-second hold of a bridge movement for just 2 to 3 repetitions. And then, reaching the arm across, rolling onto the belly, I recommend that people just do something simple like this to press on up and improve motion of the lower back. Sort of a pumping effect to the spine and the back just to loosen it up. Just 5 of these or so. And then there's really 2 ways to sort of get out of bed. So that's the movement prescription that I'd recommend. And then what I'd say is if someone's in this position, what I have them do is I just have them walk off the bed. So if the bed is high enough, notice how I push on up and I keep my back tall, and then I can go about my day. If that doesn't work or the bed's not high enough, we can simply roll to the back or to the side, and then just make sure that we push on up rather than sort of zombie-like coming out of a coffin type of thing or out of the ground. Make sure we roll on over and then push on up. So there's a couple specific movements that can be done right before getting out of bed first thing in the morning to reduce any type of stiffness. And it's often something I recommend. And often people will get up, feel better, and move better first thing in the morning. So if this was helpful, please comment, like, or share, or call 484-552-3767 for natural relief. Thanks, everyone.